صباح الخير. ما أعرف الصوت واضح عندكم؟
ايه دكتور واضح.
So start with the lecture. عددكم هسه 129.
كيف دكتور؟ ربع ساعة 9 دقيقتين
حتى يصير هم وقت للدiscussion for the small group. Okay.
ماشي دكتور.
So starting with our lecture, which is the renal replacement therapy. First, you know in the previous lecture what is the definition of chronic kidney disease. Is the progressive and irreversible loss of renal function over a period of months to years. And the renal tissue is replaced by extracellular matrix in response to tissue damage, which is the dark side of wound repair. This will result in progressive, irreversible chronic kidney disease, what we call it the uremic syndrome. ما أعرف السلايدات ما قاع يعني بالسلايدات you have to follow me. Okay. So this is the first slide of the lecture and the definition of chronic kidney disease, which is the progressive and irreversible loss of renal function. This will collectively result in a progressive chronic disease and the results of the uremic syndrome. Next, please. Okay. So permanent renal failure in adults is commonly defined as an irreversible glomerular filtration rate, the GFR, of less than 10 ml per minute, or a serum creatinine level of greater than 8 milligram per deciliter. That's mean the irreversible. Sometimes the creatinine level 10 elevated in some patients more than 8 milligram per deciliter, but it is reversible. Permanent renal failure is irreversible glomerular filtration rate of less than 10 ml per minute and irreversible creatinine level of greater than 8 milligram per deciliter. Now the core of our lecture is the renal replacement therapy. Next, please.
دكتور بلا سلام عليك دكتور.
نعم.
الصوت كلش ناطي منه.
اوكي راح اقرب. Renal replacement therapy, the purpose of renal replacement therapy are to prolong and maintain the quality of life. The treatment or treatments that are chosen for an individual patient are those that will allow the longest extension of useful life. The definition is very precise. Extension of life with good quality. So good renal replacement therapy which can achieve extension of life with good quality for the quality of life for the patient. Next, please. Renal replacement therapy required when native renal function declines to a level no longer adequate to support health. Usually when glomerular filtration rate less than 10 ml per minute. You know the normal is, 10 ml per minute. You know the normal is 100 ml per minute. Next, please. In general, we can classify the renal replacement therapy into dialysis and renal transplantation. The dialysis including hemodialysis and peritoneal dialysis, what we call it continuous ambulatory peritoneal dialysis. And renal transplantation according to the donor, either living related donor or cadaver donor. Next. Next, please. So now what are the indication for initiation of dialysis? These including severe uremic symptoms, acidosis, pericarditis, fluid overload in the form of pulmonary edema, for example, or hyperkalemia. These are the absolute indication for initiation of dialysis in patients with a chronic kidney disease. Next. So dialysis, to pass it through, according to the principles of Thomas Graham, which is a chemical scientist, the dialysis depends on two principles. First, we should have a semi-permeable membrane and a specific type of dialytic fluid. This will enable some of the particles to get rid from blood through the semi-permeable membrane, and by this, the waste product can pass out of the blood. Next. Starting with the hemodialysis, what are the requests for hemodialysis? First, we should have hemodialytic machine, artificial kidney, highly purified water, vascular access, anticoagulation, and logistics in the form of purpose-built facilities, trained staff, and transport arrangement. Next.
دكتور
نعم.
بس هنا شنو قصده بارتفيشال كدني؟
Artificial kidney is the same, يعني it's the hemodialytic machine.
واضح دكتور.
طبعا احنا بالنسبه يعني peritoneal dialysis, we depend on the peritoneal membrane itself as a semi-permeable membrane, while in the hemodialysis machine we depend on artificial or synthetic semi-permeable membrane to get rid of the waste product from the blood. Okay.
دكتور شنو فائدة هاي الفستولة؟
هسه احنا راح نبدي بهذه الفستولة. طبعا to start with hemodialysis, we should have a good access into the vascular system with good and permanent venous access. You know, the vein have a thin layer of smooth muscle, and to have a good access for the venous system of the body, we should have this procedure which is called arteriovenous fistula. This will causing arterialization of the vein by thickening of the smooth muscles of the vein, and by this will permit good access of the cannula of the machine into the vein. And this anastomosis between the cephalic vein and the radial artery. Okay. طبعا هذه الارتريوفينوس fistula done before the transplantation, before the dialysis. Sometimes we need the dialysis more urgent. We should have arteriovenous shunt or double lumen catheter. Okay. Next, please. So what first that comes to your mind when looking at this picture? First, I think we have to appreciate the creature of the God, look at the size of the machine, and compare it to the size of one kidney. And when you compare the function, there will be no comparison. However, at the same time, we have to appreciate the work of the scientists who developed and discovered this machine, because it obviously saved and elongate the life of millions of people over the world. Now, what are the advantages and disadvantages of hemodialysis? The advantage, it's effective and the survival of more than 25 years, 4 to 7 days free from treatment, and the dialysis dose easily prescribed. While the disadvantages, including fluid diet restriction, limits holidays, access problem that we discussed about the arteriovenous fistula. The arteriovenous fistula might, during time, might fail, and then the patient need another fistula. Cardiovascular system instability, high capital costs, and hospital-based. The peritoneal dialysis or continuous ambulatory peritoneal dialysis require peritoneal membrane, peritoneal blood flow, and peritoneal dialysis fluid. That's mean patients with abdominal surgery, laparotomy with disrupted peritoneal membrane might not fit for this type of a treatment. Patients with severe arterial insufficiency with insufficient peritoneal blood flow might unfit for this type of treatment, okay? So it needs peritoneal membrane, intact peritoneal membrane, peritoneal blood flow, good peritoneal blood flow, and peritoneal dialysis fluid.
دكتور بس تقدر تشرح شوية البريتونيال دياليسيس بلا زحمة عليك؟
يعني انتم المطلوب من عندكم مو يعني in details. That's it. يعني احنا بالنسبة للperitoneal dialysis نسوي فد access into the peritoneal cavity through which, according to this picture, after this يعني access into the by special catheter into the peritoneal cavity, وهي تبقى exteriorized through the abdomen, and the patient should care about its sterilization. And there is a special peritoneal dialytic fluid that infused, just like the picture, into the peritoneal cavity. After that, it is closed, and there will be a time that this fluid inside the peritoneal cavity will make the, طبعا هو in special concentration that make the waste product of the blood, which is passing through the capillaries of the peritoneal membrane, to exteriorize or get out from blood into the this fluid. And then the fluid will be exteriorized, containing the waste product and urea and creatinine. Okay? Is it clear?
واضح دكتور.
يعني الانفيوجن مو يعني يكون سريع، لازم يبقى الفلويد inside the peritoneal cavity for time for the diffusion of the waste products from blood inside the capillaries of the peritoneum into the fluid inside the peritoneal cavity. After that, we exteriorized this fluid outside the body. Okay? the previous slide about the peritoneal dialysis, the advantages and disadvantages, please. Peritoneal dialysis, advantages and disadvantages. Yes, that's it. So the advantages of peritoneal dialysis: low technology, home technique, easily learned by the patient and by the family, allow the mobility of the patient, and cardiovascular system stability, and it's fit and better for elderly patients and diabetes. And then what are the disadvantages, including frequent exchange, no long-term survival yet, يعني ماكو فد statistics about the long-term survival, frequent treatment failure, peritonitis, limited dialysis dose range, and high revenue costs. The gold standard for renal replacement therapy is the renal transplantation. All patients with progressive kidney disease or end-stage renal failure should be considered for transplantation. طبعا إذا نرجع if we return back to one of the slides of hemodialysis, can you return to the advantages and disadvantages of hemodialysis? Yes. This is a very important point in hemodialysis. Is first, the patient, although the life expectancy and the life can be extended by the hemodialysis of about or approximately more than 25 years, the patient can still in the hemodialysis mode of treatment of renal replacement therapy. However, the disadvantage, it's hardly affecting the quality of the life of patient. First is by the fluid and diet restriction for the patient. Second, which is very important, it limits holidays. The patient يعني إذا يريد يسافر، إذا يريد يطلع، هو لازم عنده frequent sessions every 4 days or every 7 days. واضح؟ This have a very important and very hard impact on the quality of life for patients with hemodialysis. It is a hospital-based. Okay, so although it can extend or prolong the life of the patient, but it adversely affecting the quality of life of the patient. واضحة هاي النقطة؟
دكتورة لو زحمة
نعم.
CVS instability شنو يعني تقصد بها؟
يعني ممكن البيشنت يا اما يصير hypotensive during the hemodialysis، او ممكن يكون يعني increasing the fluid overload. But in most of the cases, the patient become hypotensive, and this leads to the يعني cardiovascular instability.
دكتور بعد سؤال
البلد.
نعم. العفو
تفضل.
يعني أسأل له يعني تكمل دكتور.
ايه تفضل تفضل.
دكتور إنه مرة كاتب إنه هاي capital cost ومرة كاتب هاي revenue cost، شنو الفرق بيناتهم؟ يعني هاي يعني متشابهات يعني
الكابيتال كوست هي الكابيتال كوست هي على الجفرمنت.
والريفينيو على الفرد.
البيشنت يبقى يعني should have يعني the dialytic fluid peritoneal dialytic fluid، يبقى يعني لازم يجهز البيشنت مالته، او هو البيشنت نفسه لازم عنده يعني dialytic fluid to be used يعني at home. اوكي.
عاش دكتور.
So the renal transplant, all patients with progressive. طبعا بالمناسبة انه the treatment or renal replacement therapy treatment is one of the right for every human being. اوكي يعني كل الحكومات المفروض توفر good quality of service for patients with chronic kidney disease because it interferes with life. So it's the right of the patient to have a good quality of treatment, whether hemodialytic machine, peritoneal dialytic fluid, or have a list for the in the listing or in the waiting list for the renal transplantation. So it's one of the human rights. يعني it's covered by the health insurance in all of the countries. واضح؟ Renal transplantation, all patients with progressive kidney disease or end-stage renal failure should be considered for transplantation. Sources of kidneys for transplantation including cadaver kidney or cadaver donor, non-heart beating donors, living related donors, and living emotionally related donors. طبعا احنا عندنا بالعراق cadaver donor and non-heart beating donor is prohibited. واضح؟ We depend only on the living related donors.
دكتور شنو قصده بنون هارت بيتن دونر؟
يعني patient يعني in the dying in the dying stage يعني non heart beating اي patient اللي هو non heart beating معناه انه هذا death او should have يعني يعني regarded as a donor.
يعني قبل لا يموت ياخذون الكلى من عنده؟
لا يعني هو non heart beating يعني confirm the death after all of resuscitation طبعا.
دكتور شنو فرقنا عن الكادافر؟
الكادافر دونر حقيقة احنا اثنيناتهم دول ما موجودين عندنا، بس الكادافر دونر هو يعني متبرع يعني موقع انه متبرع بالاعضاء مالته، بس هنا ما اعرف هذه حقيقة، يعني ما اعرف what is the difference between cadaver donor and non-heart beating donor. طبعا اثنيناتهم احنا ما موجودين عندنا، وهي هاي يعني arranged by law يعني مو arranged by يعني medicine. اوكي.
نعم دكتور.
living emotional related donor it's clear يعني مو إلا related ممكن emotionally related but in all types we is a living. Okay, this is a picture for renal transplant. The donated kidney transplanted into the recipient and the anastomosis taken end-to-end anastomosis between the renal artery and the internal iliac artery, and the renal vein end-to-side anastomosis with the external iliac vein, and the ureter reimplanted directly into the bladder. Next. Now, what are the advantages and disadvantages of transplantation? The advantage, restore near normal renal function, allow mobility and rehabilitation of the patient, improve survival, good long-term result, cheaper than dialysis. يعني من تحسب when we collect all of the cost which is taken in the dialysis, it is much more than that of single procedure of transplantation. The disadvantages of renal transplantation, not all are suitable. Limited of the donor supply is the most important obstacle for patients with transplantation. Operative morbidity and mortality, lifelong immunosuppression treatment, and the patient might be still left with progressive kidney disease. What is the meaning of that? يعني patients اللي هم مثلا عندهم diabetic nephropathy, when we receive a transplanted kidney, the disease might recur in the transplanted kidney. Okay. Thank you. راح هسه ادزكم الرابط مال الحضور، سجلوا الحضور في 5 دقائق ونبدي بالسمول جروب. اعتقد انه سؤالين بس السمول جروب لو اكثر.
دكتورة لو زحمة الرينال ترانسبلانتيشن، بس لو زحمة عيدنا الانستموسز مال الشرايين والأوردة ما لحقنا نكتبهن.
لا هذا ما يحتاج كتابة، يعني انتم بس تاخذون بيكتشر، هذه واضحة من البيكتشر. احنا عندنا الرينال ارتري، اذا تطلعون الصورة قصدكم الارتريوفينوس فيستولا لو الرينال ترانسبلانت؟
لا دكتور، رينال ترانسبلانتيشن آخر شي شرحتها.
رينال ترانسبلانت نطلع البيكتشر مرة ثانية. This is the donor kidney. طبعا بها renal artery و renal vein. Renal artery anastomosed end-to-end anastomosis between the renal artery and the internal iliac artery. It's clear from the picture. واضح. Okay. While the renal vein end to side anastomosis with the external iliac vein, and the ureter reimplanted into the bladder directly by reimplantation. واضحة؟
بلي واضحة.
دكتور
بعد
بس إذا تقدر توضح الغرض من الفيستولا هاي، يعني بالبداية الارتريوفينوس فيستولا ما افتهمتها.
The arteriovenous fistula to enable good access into the vascular system, into the venous system. لأنه we have cannula، وهاي الكانيولا يعني تاخذ blood من الفين وترجع له. واضح؟ So we should have good venous system. يا اما نختار central vein ويا اما نختار peripheral vein. المشكلة بالperipheral vein انه it is easily ruptured because of a smooth muscle layer. واضح؟ فشنو اللي نسوي؟ arterialization of the vein by connecting the artery into the vein. This fistula, by time about 7 to 10 days, due to the high current of blood, will making the vein increasing in the thickness of the smooth muscle. واضح؟ become much more less reliable for rupture during the procedure. واضح؟ مكان ما نختار central vein نختار peripheral vein، بس هذا peripheral vein نسوي له adaptation بحيث will enable good access of the cannula of the machine. واضح لو لا؟
واضح دكتور، عاش سيدك.
بعد اكو سؤال عندكم؟ نعم.
ليش البريتونيال دياليسيس افضل للناس اللي عندهم سكري؟
Because of the hemodynamic stability. Okay.
تمام.
And تعرفون انه diabetic patient, much of the patient will end with end stage renal disease. احنا نخلي الهيمودياليسيس هو for second line of treatment if the patient not responding to peritoneal dialysis. يعني first line of treatment هو peritoneal dialysis. If the patient fit for peritoneal dialysis اللي قلنا intact يعني peritoneal membrane, good blood supply into the capillaries of the peritoneum. واضح؟ لأنه هذا بأدفانتج إنه ممكن يسويها بالبيت. learning curve مالتها very simple. It can be learned by the patient and by the family member. ويقلل الامباكت والكوست على الهوسبيتال and the renal replacement institutes. واضح؟ If the peritoneal dialysis fail, then the patient might be fit into the hemodialysis. طبعا الجولد ستاندرد should have waiting list for renal transplant. بس احنا عندنا shortage بالرينال transplant بسبب التشريعات، لانه احنا we are only depend on the living donor transplant. اكو سؤال بعد؟ هذا الرابط موجود بالشات، زين تسجلون بالرابط، و5 دقائق نبدي بال discussion of the small group question.